What if I told you the cure for cancer might already exist, but you'll never get it? This is Kenya News Update today. Coming up, you'll discover how AI is quietly taking control of medicine and why your next diagnosis might come from a corporation instead of a doctor. Meet Professor MarkAnthony Nze, a leading health researcher. His new report reveals a seismic shift, but here's the twist. This isn't about better technology. It's about who owns the intelligence that defines your health. Every medical system, regardless of its instruments, ultimately answers to power. Who controls access? Who defines what care is? Artificial intelligence hasn't changed this reality. It has intensified it. As AI systems now mediate diagnosis, triage, and drug discovery, authority over your health is migrating. It's moving away from public hospitals and your doctor's judgment and toward private actors who own the data, the models, and the infrastructure. Shaw and Glover capture the moment. AI in healthcare is a redistribution of authority. Decisions once anchored in clinical ethics are being relocated to platforms and investors whose incentives are scale and profit, not your well-being. Medicine has always had a tension with markets, but what AI introduces is velocity and distance. Your care becomes data. Your doctor's judgment becomes an output. Your personal insight becomes licensable intelligence. Lee describes a new data-centered health economy. Value no longer comes just from treating patients. It comes from controlling the informational infrastructure. Your local hospital generates data as a byproduct. Tech firms in Silicon Valley or Shenzhen extract value from that data. And you, the patient, whose body and history are the raw material, remain excluded from the value chain. Caprero shows that generative AI magnifies this imbalance. Productivity gains flow to those with capital, compute, and proprietary data sets. Inequality isn't disrupted. It's encoded into the very algorithms. This outcome is not a market accident. It's the predictable result of ownership structures. In pre-digital medicine, authority rested with clinicians accountable to you. In AI-mediated medicine, authority resides with those who design, train, and control the models. Think about it. A diagnostic AI in a Nairobi hospital might be owned by a foreign corporation. The algorithm that prioritizes your mother's surgery could be a black box, its logic a trade secret. The drug discovery platform finding new cures is funded by venture capital seeking a 10x return. The question medicine can no longer avoid is this: who governs the intelligence that now defines what care is? Some say this is progress, bringing cutting-edge tools to Kenya and the world. Others warn of a new colonial era, where health sovereignty is lost to digital platforms. But here's the part that will blow your mind. This shift is happening right now, in procurement contracts and licensing agreements you never see. It's embedded in the software your county hospital just bought. The implications are massive. Will AI cure diseases? Possibly. But the real question is, who will control the cure? And who will be left behind when care becomes a commodity optimized for profit, not people? The nurses and doctors in our public hospitals face this every day. Do you trust a corporation with your family's health data? Do you believe AI will make medicine fairer, or will it just make it more profitable for a few? Subscribe to Kenya News Update today for more on who really controls your future. And drop your take in the comments. Should AI in medicine be a public good, or is private innovation the only way forward?